Hello, Dr. G here from naturalfoodsdiet.org. Are you taking a vitamin D supplement? I know vitamin D supplementation has gone mainstream. Patients of mine that see other providers are often on large doses of vitamin D. And that's because doctors today are measuring vitamin D levels on most of their patients. I often see the dose of 50,000 IUs. That's the prescription dose of vitamin D2, which I recommend avoiding like you would avoid the plague. The first question this brings up is, why do we have an epidemic of low vitamin D levels? The second question is taking pills of vitamin D a good option? Today I want to discuss some of the evidence out there that might help answer this second question. And I'll give you my take on the first question, which is, again, why do we have such low vitamin D levels in the population? There were two studies published last year that performed systematic reviews and meta-analyses of the observational studies on vitamin D and the randomized trials of vitamin D supplementation. One of the reviews looked at 1,256 published studies and 87 different meta-analyses. These reviews were published in the British Medical Journal and Lancet Diabetes and Endocrinology in 2014, as I said. The observational studies of low vitamin D levels showed significant correlation with health problems. In other words, a low vitamin D level are correlated with health problems like colorectal cancer, non-vertebral fractures, cardiovascular disease, hypertension, high blood pressure, stroke, cognitive problems, depression, increased BMI or being fat, metabolic syndrome, type 2 diabetes, gestational diabetes, decreased balance, increased LDL or bad cholesterol, decreased muscle strength, and decreased bone density. Okay, you can see from this list why so many people and their doctors have jumped on the bandwagon of testing vitamin D levels and then supplementing with vitamin D, especially when their results come back crappy. Yes, that is a medical term, by the way. So the other part of the review is looking at the randomized trials of supplementing vitamin D versus placebo. In other words, does supplementing vitamin D make any difference as far as reversing or preventing these bad health outcomes that I just listed? I'm going to sum up the results of the trials very briefly. There was no consistent pattern of benefit. That's pretty brief. You may have heard of trials showing a benefit with vitamin D supplementation, such as with fractures and bone density. I know I heard about those, but these results were not found when subsequent larger trials were done. I looked at the conclusion of these two studies to see what the authors thought the reason was. The reason that low vitamin D levels correlate to disease, but supplementing doesn't seem to have any impact. The authors mentioned things like, well, maybe the control group was sneaking vitamin D pills under the table. Or another likely reason would be that low vitamin D levels are just a marker of bad general health, but not a cause of it. Today, I'm going to give you what I feel is the real reason the vitamin D trials were a failure. Low vitamin D levels, in my opinion, are a great marker for a poor environment. And you say, hey, Dr. G, what's a poor environment? Big one is lack of sunlight. And modern humans, especially the ones that listen to their doctors, stay out of the sun almost completely. That's in addition to our indoor lifestyle. We have become insulated from nature. It's known in science that the UVB spectrum of sunlight first causes a sulfation of cholesterol and secondly converts sulfated cholesterol into sulfated vitamin D. The sulfation process is critical. In vitamin D3 or D2 supplements that you take are not sulfated. And that might be the whole problem. You see, vitamin D sulfate is water soluble, and it can travel where it needs to go within the body. The vitamin D you take in a pill is fat soluble, and it needs to be carried by a protein carrier like LDL that you may have heard of. To have good sulfated vitamin D level, you need to be exposed to UVB light. UVB light is blocked by things like these glasses, sunscreen, clothes, air pollution, clouds, and there's a significant vitamin D winter if you live too far from the equator, which is most people in the United States. But in my opinion, that's not the only factor involved. To properly utilize sunlight, there are two other factors that are critically important. The first is the DHA content of your cell membranes. If DHA isn't present sufficient quantity, sunlight cannot be utilized. DHA levels in our population stink. And that's also a medical term, by the way, because of our processed food diet. Remember, you get DHA from seafood. Fish oil pills can have a similar problem as vitamin D3 pills when you compare them to eating seafood in nature's package. The other aspect of low vitamin D is related to non-native electromagnetic field exposure, which causes calcium efflux from cell membranes, raising calcium levels, and through a negative feedback loop, actually lower vitamin D levels. So the real cause of a vitamin D drain on all the people in the United States might be our modern habit of staring at artificial blue light in our indoor lighting and the blue light emitting devices that we're looking at constantly. And in this instance, if you're taking vitamin D3 or D2 supplements, you may actually harm yourself by raising your calcium levels further. There's no negative feedback loop for vitamin D absorption through the gut, but there is one for vitamin D we get the natural way from the sun. This is another big reason to get your ass back out into nature so that you don't overdose on vitamin D by taking a pill. So what can you do if your vitamin D levels stink? Obviously, you need UVB sunlight. There's an app you can get from the Vitamin D Council website that tells you the hours of the day that you can get natural UVB from the sun at your latitude. The other is to be sure you have enough sulfur in your diet. Good sources are eggs, onions, garlic, leafy dark green vegetables, pork and other meats, nuts, and seafood. You need daily DHA, which is from seafood. You also need to decrease your exposure to non-native electromagnetic fields, including blue frequency light. I have other videos that go into this in far more detail. Be sure and check those out. Are vitamin D pills good to take? The evidence appears to show that they don't do much good. But we also know having a low vitamin D level is not good either. I have my patients take supplements sometimes, but I try to emphasize that supplementing is not the answer. And it is possible that you could be causing more harm than good. I personally and many of my patients have been able to obtain an optimal vitamin D level without any supplementing. And the optimal level is around 70. And how did I do that? By following these recommendations I just gave you. Now that's proof enough for me. This is Dr. G. Thanks for watching. If you like this kind of health information, please subscribe to our channel.